Want to know more about a safe psychedelic today? Check out this video.
What do Albert Hoffman, Calvin Harris, Anthony Huberman, Jordan Peterson, Joe Rogan, Aldous Huxley, Timothy Leary, John C. Lilly, Ram Dass, Aaron Rodgers, Rick Doblin, Mike Tyson, Michael Pollan, and Casey Dubravcic have in common? They're all pioneers in the psychedelic space.
I'm Casey Dubravcic. I'm a psychiatric mental health nurse practitioner. I've been in healthcare for 20 years, and I've got a ton to tell you about how to get out of your own way, how to use ketamine treatments and other psychedelics to let the walls down safely, to be more awesome, to be the radical human being you were designed to be. You won the lottery being here. Keep it up. Yes.
Hi, my name is Casey Dubravcic, and I want to talk to you about ketamine treatments. See if these are right for you, and see about this treatment, and see if perhaps it's a good fit for you. So who am I? My name is Casey Dubravcic. I'm the owner, operator, founder of Revitalize Ketamine Clinic. I've been in healthcare since 2004, worked in the ICU, CVICU, pre-op and PACU, as well as the local inpatient, outpatient behavioral health units at Flagstaff Medical Center. I'm trained in electroconvulsive therapy, worked in the adolescent inpatient unit, also in the inpatient, outpatient units at the Guidance Center, the local community mental health center. I was only child provider over there for a couple of years, so super interesting stuff. I love what I'm doing. I opened a Revitalize Clinic in September of 2021, and I'm incredibly passionate about mental health and becoming the best version of yourself. So why? After being in healthcare for 20 plus years, I realized there's a lot of room for improvement. Honestly, traditional psychiatry, it's kind of soul sucking. Most of the time, we're simply treating symptoms of underlying problems. Basically, the monoamine theory, where someone's depressed, their serotonin's depleted. The last 30 years or so, a lot of the school of thought has gone around. Let's replace that serotonin. That'll help with depression, and thereby people will be better. We're finding that's really not the case. You think of mood super basically as a waveform. Um, Ketamine's really just, it has the capacity to really help you treat the problems that are causing the symptoms. And you think of that waveform of mood where depression, anhedonia, that I don't cares are down here, and then anxiety and kind of that pucker state up here, that anxiety. And pretty much every medication that I ever prescribed, about 10 to 30% effective, and just kind of squishing that waveform. So people may be less depressed, maybe less anxious, maybe less movability, maybe less suicidality. In general, kind of less everything. My opinion, and a growing number of psychiatric providers, is that those symptoms are your psyche's cries for help. Hey, what we're doing isn't working. So as a provider, yeah, absolutely, there's still a place for daily medications. Helps people get out of bed in the morning, helps people go and see their therapist. It's a good thing, and I'm a fan of it in certain situations. That being said, we know there's better when we're treating the problems that are causing the symptoms. And I like to tell people, and it's not great for business, no one needs ketamine. No one needs an ego dissolution agent. There's a million other ways to get to a healthier headspace, and in general, a non-specific amplifier of the human experience. So ketamine, it's got psychedelic properties, so it falls closely in line with other ego dissolution agents. So MDMA or ecstasy is probably the best well-tolerated ego dissolution agent by a large swath of the population. This is what we're calling in the psychiatric community an empathogenic. So really it feels safe to feel safe very quickly. And that's a foreign sensation for a lot of people coming from early and often chronic trauma. The second best well-tolerated ego dissolution agent is ketamine, and it's here now, and it's legal, and it's incredibly safe. Been studied since the 1960s. I'm a huge proponent of it. Rick Doblin, the founder of, or one of the founders of MAPS, the Multidisciplinary Association for Psychedelic Studies, he said, eventually, when everything's legal and well regulated, ketamine's not going anywhere. It's the perfect kind of ego dissolution agent for a capitalistic society. You're in and out, 45 minutes, hour and a half. So again, I'm incredibly passionate about you living your own best life. What's good for you is good for the universe. I'd love you to be out of a job. I'd love you to get better. Traditional Western medicine is very much a potentiated illness model. So we know the pharmaceutical industry, insurance industry, and honestly, most providers and agencies are somewhat incentivized by the system that we're all kind of entrenched in to keep people ill, keep them kind of circling the bowl, taking those daily medications and coming back indefinitely. So here we're working off a wellness model. And part of that wellness model is really the ability to become your own best healer. And so we want, after we get people kind of sent off, that lift off, like ideally we don't want to see you again. So, really cool to be able to and help advocate for that. So where does it come from? Where does this hypervigilance? Where does this pucker state come from? So really, in my opinion, at this point in my career, everything falls from trauma. Everything is a coping strategy for that trauma. So, depression, you're more likely to be withdrawn, less likely to have any potentially traumatizing stimuli. Anxiety, hypervigilance, you're going to be quick to respond from and get away from what your autonomic nervous system perceives as a potentially traumatizing stimuli. Oftentimes, it isn't that or isn't that traumatizing. That being said, at some point in your past, having that hypervigilance was incredibly helpful and safe. So all that comes from trauma. That being said, I don't like PTSD. It makes people feel damaged, it makes people feel broken, it makes people feel unhealable. I like PTSI, post-traumatic stress injury. And we're all composition of those big capital bold T's. You're talking like early and often physical, sexual, emotional abuse or neglect or trauma. And then there's little italic T's, right? And so those are like those chronic invalidations. You're not good enough, that sort of thing. So think about, you're watching a movie with a loved one or a friend, a sad part comes on about a puppy, and you're like, oh, isn't that sad about the puppy? And they're like, oh, you're stupid, Casey. It's not sad. I'm like, oh, right. We all take those on. And so we're all a combination of four major types of trauma. The historical, intergenerational, societal, and environmental. I like to reiterate, the whole premise of these treatments and getting out of your own way is what we call the intrinsic response methodology. It's a term that I coined. And basically, the whole premise of that is you'll always be your own best healer. And so once we get out of the way, or get out of our own way, then we're able to take ourselves where we need to go. And a common idea in this kind of work is you need to feel it to heal it. And it can really fast track treatment outcomes. And so it's a next level in regards to treatment outcomes. I've seen clients who have been seeing the same talk therapist for decades, and then they come see us, do an induction series. That therapist calls me up, like, hey, Casey, oh my gosh, like this patient has had insights like I don't believe. I've been working them for this long, and just now they're coming to all these really profound realizations. Like, thank you so much for working with them. Really appreciate you. And that's why I do this, right? Helping people help themselves. It's incredibly rewarding. And so, four types of trauma. Again, first type is historic. So I should go back up. So trauma is super subjective, right? So one person can see their best friend ever blown up next to them on the battlefield, not be terribly affected, genetic factors, resiliency. Another person can be called a name once on the schoolyard. It can haunt them forever. It has a large part to do with your empathy, how connected you are to your own emotionality, as well as the emotionality of those around you, and kind of that greater collective emotionality. So we're social creatures at heart, and we are tribal, like at our core. And so an empathic person is able to carry the load of, between 40 and 60 people. And when there's reciprocity, without the reciprocity and without kind of a tribal environment, this economy of scale, disconnected family unit, not great for our brains. And that's the reality we're existing in. And so that causes that empathy to be not a superpower or not perceived as the superpower that it truly is. Because our society has decided that different value sets have been valuable up until now. Another thing I like to say with the trauma is that, well, with the empathy, intelligence and empathy is a deadly combination. So we all hold on to a lot, especially people that have been through a lot. You're able to and you're capable of it. At a certain point, that can be a detriment to us. And so Now, the four types of trauma. So, the first type of trauma is historical. And so, we know every catecholamine or stressor exposure that you've had since your parents' two zygotes first met is what we call historical trauma. So, all the stress your mom had during pregnancy, your actual childbirth, everything before you started forming concrete memories, and everything to where you're at now. That's just the first type of trauma. Second type of trauma is intergenerational or epigenetics. And so we know at least 5 generations behind us, the trauma that our great 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 grandparents went through prior to procreating mutated their DNA at least enough to pass on increased hypervigilance to us, which is good if we live in a township surrounded by saber-toothed tigers, not necessarily if you're a relatively healthy environment. And or if you're living in a chaotic family home unit, that intergenerational epigenetic trauma can be an incredible helpful thing to help you kind of have more resiliency when it comes to interacting with those chronically traumatized family members. Third type of trauma is what we call societal trauma. And honestly, this is what pushes people back through our doors more than anything. So we know in general, living in a patriarchal, capitalistic society with an economy of scale and a largely disconnected family unit, pretty bad for our brains. And that's the reality that we exist in. Fourth type of trauma is environmental, and those are the things that you really can't get away from. You're talking about microplastics, cell phone radiation, those types of things. Again, I like to reiterate, all traumas, the big capital bold T's and the little italic T's, they're all healable and or integratable given the right setting and circumstances. And so the epigenetics, it's more the expression of your genetic patterns than actual mutation of the physical DNA, we think. And so there's a ongoing science in that regards. And so why? Again, traditional medications of all types, SSRIs, SNRIs, mood stabilizers, antipsychotics, benzodiazepines, hypnotics, about 10 to 30% effective long term. And again, just kind of squishing that waveform. Oftentimes people feel less everything, the zombified, right? That's a real thing. Ketamine, when given intravenously, is between 70 and 95% efficacious. And at our clinic, we're on closer to the topper number there. That being said, it's not 100% effective. I don't like to overpromise and underdeliver. And it is a world away from anything else I've ever prescribed. And it really helps people treat the problems that are causing the symptoms, which is also a next level treatment modality. These treatments have proven to be a literal lifesaver for many, and we've mitigated inpatient stays and that sort of things. And this is the only treatment that we have that's 95% efficacious for suicidality, which is just awesome. All right, so why? Again, this is a visualization of the neuroplasticity. So I like to think of the depression, the anxiety, the hypervigilance, the suicidality even as these chronic sled paths, right? You go down a sled track a couple times, gets pretty hardlined. Go down a million times, it's basically a toboggan trail, almost impossible to get off of. And so with the ketamine, when you do an induction series, which is a series of 6 treatments with a booster infusion 3 to 5 weeks out, that's like 5 feet of fresh fallen snow on top of those old toboggan trails. So it really gives you that capacity to quite literally change your mind. Within 2 or 3 minutes of starting a ketamine infusion, we see new dendrites forming on a functional MRI, which are those dendritic pathways, which has the capacity to be a positive pathway. So those toboggan trails, those old nasty toboggan trails of the depression, those old pathways are still there, underneath the snow. So if we don't change anything else, it's possible to go back on them. And so that's why I really like to reiterate that these treatments are a catalyst for change. Nothing is a panacea, nothing is a cure-all. And so really it's an energy in, energy out kind of equation. And so when you do just one infusion kind of by itself, you get about 7 to 10 days of really good neuroplasticity, that ability to change your mind. When you do, again, what's called an induction series, like stacking 6 of those bell curves on top of one another. Some people can benefit from extending that induction series out a bit further to as many as 12, is what the latest research shows. And really, it's an individualized kind of approach. We don't like to sell people more than they need. And so we have that discussion with people, kind of set the stage so we can talk about the best individualized treatment pattern for you or for your loved one. The reason we do the series of 6 and the 1 month booster, and again, that's how we're operating off a wellness model. And so after a series of 6 and a 1 month booster, like ideally, we don't want to see you again. There's enough people suffering out there that we're pretty safe here. Again, that third type of trauma, that's societal, that's still there. And what we see, again, I like to be completely upfront and honest with people, is on average about every 3 months, people get kind of coming back in to do just a single booster infusion. And that keeps you going. So, and there's a cool book, The Immortality Key, The Secret History of Religion No Name, talks about how people as far back as about 12,000 BC really had ego dissolution agents similar to ketamine, and they used them on average about quarterly, about the change of a season. So it was kind of interesting. And that being said, it's very individualized, right? After a series of 6 and a 1 month boosters, some people never see us again, which is ideal. I love that because they're doing so well. Some people annually, some people every 6 months. Some people see us monthly during the winter and not at all during the spring, summer, and fall. So it's really an individualized kind of thing, and I think it's important to recognize that. Um, the the other thing, the reason we do that series of 6 and 1 month booster is that creates an 80-day window of really good neuroplasticity. Again, that 5 feet of fresh fallen snow. And so that allows for us to, the 80-day window is what human beings need as human beings to create new pathways and to break old pathways. And so that's the amount of time it takes to create new habits and to break old habits, 80 days on the top end. So that's why we do it in that fashion. I like to say, people have come to us after being in treatment for decades and decades often. It's nice to have a treatment that's somewhat novel, somewhat new, groundbreaking, if you will. Really, it's an exciting time to be in medicine because we're proving past wisdom with science. Ego dissolution agents were kind of really shoved underground around 1600 AD, 1650, I think, the last chronic usage above ground in Catalonia, España. And then it really went underground, came resurgence in the 1960s and 1970s, somewhat unethically, if you will, in my opinion, where there was a lot of people overusing and really touting ego dissolution agents as this kind of cure-all, and it really isn't. It's one piece of the puzzle. It can be an incredibly beneficial and powerful piece of the puzzle. And it's really much more important what you do afterwards than what actually happens during a treatment. And so the ketamine treatments that we provide here at Revitalize Ketamine Clinic really do offer hope and really do act as a catalyst for change. I get the chills every day I work watching people let go. I had a client say it recently. It's like taking a few bricks out of that rucksack every treatment. And that's what we're seeing is people feel lighter, people feel like they're able to handle more, like their resiliency is higher. Like the world isn't stopping throwing punches. They're just getting better at parrying them and getting away from them and getting out of that pathway. And so really cool stuff. In general, we think less is more when it comes to medication. So really don't like to give much else besides the ketamine. Sometimes we'll give some modified Myers cocktails with glutathione in the form of the revitalizer here. And I think that can be a really beneficial thing for a lot of folks. So I meant to talk about Maslow's hierarchy of needs here. And so with Maslow's hierarchy of needs, I like to think of it, at the bottom is that kind of safety and security, basic needs. And then at the top is the self-actualization. Then I like to flip that pyramid. And so the very next stage is true love for yourself. Everything that you've ever done, I tell people at this point, no regrets, right? Not even one letter. Everything that you did was a coping strategy to help you get here. And so you are here. So good job, me, right? And then is a moving target. The journey to wellness is just that. It's a journey. And we all are ideally working to be slightly better today than we were yesterday and slightly better tomorrow than we were today. Just you being here, you listening to this, I think prognostically, you're probably in a better headspace than you have been in the past. And there's some real hope to be had just being this deep in this thing. And so look at that 5-year stock market graph for yourself. When you zoom out, it looks real good, nice, even upward kind of slope. zoom in, it's like a 5-year stock market graph. There's going to be some dips, there's going to be some psychosocial stressors, there's going to be some issues that you face. And when that happens, it's going to feel like, oh my gosh, not this again. And you're capable, and this is about helping you remember how capable you are of actually doing that work. And so, again, flipping that pyramid on the next stage after that kind of real understanding of oneself comes true love for yourself. And once you truly love yourself, then the next stage is love for other people in your life. You can't really love another person until you truly love yourself. And then after that love for other people, the next thing is really love for everything and everyone for everything that they bring. And so, that's hard, right? I thinking of all the things that people do to other people, the atrocities of the world, that sort of thing. It's hard to not get a little resentful. And you know, that's part of being a human. You see those types of things, and you've got these visceral reactions. And so it's important to recognize that there's no such thing as good and bad emotion, only bad emotional reactions, right? And so all those emotions are our body viscerally teaching us. And so it's important to listen to those lessons and not tamp it down. When we tamp it down, that's when the chronic trauma develops. And that's what we see. That's where like there's debriefing after a pediatric code in the emergency department or something like that. We know the science supports getting it processed sooner than later and not having to tuck it down to deal with the next thing is how people and human beings really move forward. All right, so how do our treatments work? So ketamine and other ego dissolution agents are, put simply, non-specific amplifiers of the human experience. No one needs ketamine. Again, there's a million other ways to get to a healthier headspace. That's what Rocked Wellness Bar is largely about. Unfortunately, our society, in large part, again, not very conducive to mental wellness. Ketamine is simply a fast tracker, and that's what we see. And it's not for everyone. This shouldn't be taken as specific medical advice to you until we actually speak, and then we can see if everything I'm saying really resonates with you. And we need to hear your specific situation to see if this treatment is a good treatment for you. So we have seen our treatments act as decades of work helping people move forward. After being in healthcare for 20 years, really every diagnosis besides trauma is, in my opinion, not very adequate to describe the situation. Again, depression, more withdrawn, less likely to have any sort of stimulus, even potentially traumatizing stimulus, anxiety, hypervigilance, more quick to react and get away from what your nervous system perceives as potentially traumatizing stimuli. And then, like it goes down like there's the personality disorders, like borderline personality disorder, narcissistic personality disorder. Then you start getting the bipolar 2, bipolar 1, and then things are hard enough for long enough. Our reality is so unsafe that we end up creating an alternate reality for ourselves. And that looks like the schizophrenia, schizoaffective, paranoid schizophrenia. There's organic schizophrenia too that can occur. Oftentimes there's a component of trauma, not always. And normally if there's a very acute psychosis onset, you can do brain image, brain scanning, and see if there's some kind of process going on there. I've taken care of enough people in the ICU, CV ICU, pre-op PACU, and of course the inpatient, outpatient behavioral health units, that most psychoses that I see are in fact rooted in trauma. And so it's interesting to look at one's ACEs score, Adverse Childhood Experiences score. It's quite telling. We know that anything 3 or higher will lead to depression and anxiety. Anything 5 or higher will often lead to some sort of somatic things like a chronic inflammatory process, fibromyalgia, that sort of thing. And so there's definitely a correlation there. And ACEs score is good because it tells us what happened to people that shouldn't have happened. It doesn't tell us what didn't happen to people that should have. And so that's an important thing to recognize. I think ADHD is a little different. And so ADHD can be potentiated by trauma. ADHD isn't necessarily a byproduct of trauma. ADHD in its true state is a true superpower. You have this laser-like focus and energy and drive for things that you're interested in. And then things that you're not interested in, it's in one ear, out the other, it's over your head. And the The only reason I ever medicate for ADHD, it isn't the individual. The individual, again, has a superpower. It's for society. And the problem is we're not a strengths-based society. We're not a strengths-based educational system. If we did aptitude testing early in life, we could recognize someone's strengths early on and then be able to focus and hone those. All the guidances, and this is what, self-help gurus also talk about, is really your strengths will always be your strengths and your weaknesses will always be your weaknesses. So you should really focus on honing and increasing your strengths and farm out your weaknesses as much as possible. If we did that as a society, we would be light years ahead, in my opinion. Mm. So, get out of your own way. Ego dissolution fast tracks your ability to see a fresh perspective and literally creates new pathways in your mind. What is ketamine? Ketamine is a dissociative anesthetic with ego dissolution and psychedelic properties. It's on the World Health Organization's list of essential medications as an anesthetic. So any usage we're using it for off of anesthesia is considered an off-label usage. Esketamine Spravato, it was so darned effective and so much more effective than traditional antidepressants that it was fast-tracked through the FDA approval process and got treatment indications for both treatment-resistant depression as well as acute suicidality. So it's interesting because what they did was they isolated the SNR enantiomer of the ketamine molecule, and then they were able to patent it, and they were able to push it through the approval process. That's a bigger discussion. They're putting a lot of time and energy into the recognition, though, for the greater public that ego dissolution is an incredible, powerful mechanism of action for people getting out of their own way and starting to do the work as that catalyst for change. It's not nearly as effective as racemic or intravenous ketamine or intramuscular for that matter. And it has a treatment indication, so some insurers cover it. So chemically, or ketamine was first discovered in 1962, and Calvin Harris, and it been heavily used as an anesthetic with great success since that time. Used in war zones, used pre-hospital, very, very safe. It's the only anesthetic that doesn't decrease the respiratory drive, and it actually supports the cardiovascular drive, which is good, increases the systolic blood pressure, as well as the heart rate, and increases what's called the cerebral perfusion pressure. So you get more of the drug across the blood-brain barrier, which again helps with new dendritic growth and creating those new pathways. So chemically, ketamine's pretty differentiated. And so we know it's an NMDA antagonist, N-methyl D-aspartate, also modulates the glutamate system. Also, it's norepinephrine and dopamine and serotonin. Also, it's the mu-opioid pain agonist receptor site. So it's good for pain and inflammation, any sort of inflammatory process. Also, it's the benzodiazepine receptor site. So it's really good for any sort of addiction. It's good for alcohol withdrawal. It's good for benzodiazepine withdrawal. And there's some evidence to support that's good for opioid withdrawal. Also, it's the mTOR pathway, the mammalian target cell of rapamycin, and BDNF, brain-derived neurotropic factor. So all that being said, it's a competitive antagonist, and it's got a really strong competitive antagonist nature. And so certain binding receptor sites are very strongly binded to by certain medications. And so it's important to talk to your provider about what you're taking regularly and to see if there's anything that might be held for the day of treatment. So we know in particular stimulants and SNRIs and some mood stabilizers will markedly decrease the efficaciousness of the ketamine treatments as the ketamine is trying to hit those receptor sites and they're strongly binded to by those medications in the system. My advice, it isn't to pull the rug out and stop all the medications. My advice is if you do want to get off your medications, you should partner with your psychiatric provider who's prescribing those medications. As an agency, Revitalize Ketamine Clinic, we collaborate closely with your psychiatric provider so we can talk about, what ultimately does the client want, right? We want to make sure that you feel like you're driving the bus. I think that's super important. Empowerment. And as far as med changes go, I don't recommend getting off of things before you get started. I think that can be destabilizing because obviously you're coming to us when things aren't great anyways. And so to destabilize further by taking off those medications, that's normally not the move. And so my advice would be if you're on a stimulant, an SNRI or a mood stabilizer, if you can tolerate it, you don't want to take that morning dose of your treatment. And then you can take it right afterwards, as long as it's not too stimulant, not too late in the day for a stimulant. Ketamine is designated by the World Health Organization as a essential medication for its efficacy in a resource limited setting, as we talked about. Ketamine's an ideal medication for the first journey to Mars because you can give it safely with no other medications for a C-section, for amputation, for lots of different things. So, starting in the early 2000s, clinicians and clinics started popping up that were just being utilized as ketamine clinics and were really standing on the shoulders of giants. And so I feel very thankful that other pioneers and were able to, pioneers and other clinicians that were ready to take on and do something new and exciting, they recognize the healing properties of ketamine. Oftentimes in the emergency department and OR, most ketamine clinics in the beginning were started by anesthesiologists or emergency room doctors who had incredible comfort level with ketamine in general as just a chemical. And so, that being said, I think it's important to recognize that ketamine was found real recently on an ergo or a mushroom. And so that was pretty cool that it does occur naturally in its kind of synthesized state. And everything does, is what I've seen, is like everything comes from the earth. I don't think there's anything that isn't, maybe octopuses, but that's debatable. But, let's see. And so, yeah, they've been using ketamine in these treatment centers in ketamine infusion clinics for depression, for anxiety, obsessive compulsive disorders, PTSD, and suicidality with great efficaciousness, again, since the early 2000s. I think the first study that they were using ketamine for trauma was in 1989 in Russia in a teaching hospital. That was the earliest one that I read of. And then most psychiatric medications take weeks to work. They talk about, 6 weeks before you notice the benefits of taking a regular SSRI. And so ketamine, 70 to 95% of people get better during or after their very first infusion, notice a significant improvement. I do like to be upfront and honest with people, that some people will notice that shift right away. Some people won't notice a shift at all, and some people will notice a little bit of a drop off. About 10 to 30% of people get a little worse before they get better. And that's because you're actually opening up that Pandora's box of things that you've been shoving down for a really long time. So that's why most of that 10 to 30% of people get a little worse before they get better. And so the the ketamine treatments are incredibly safe. They're around and they are more robustly and fastly acting than most medications that we prescribe, with far less side effects, and it's very short acting. And so the actual ketamine's out of your system within hours after an infusion. The neuroplasticity, again, after a single infusion remains for 7 to 10 days. When you do the induction series, it's much longer than that. SSRIs, SNRIs, mood stabilizers, there's a myriad of side effects, sexual side effects, headaches, weight gain, just to name a few. So, some important notes, it's not all sunshine and rainbows. And it's important to approach things with cautious optimism. And so I like to just kind of have some segue into that. So ketamine treatments are not for everyone. Really, an individualized consultation should take place so that we can determine if these treatments are right for you. 70 to 95% of people who go through an induction series notice improvements. Most of those people pretty quickly. 10 to 30% of people get a little worse before they get better. Because again, you're actually opening up that Pandora's box of things that you've been shoving way down for a long time. You need to feel it to heal it. So ideally, you're seeing an integration therapist. So a traditional induction series, 2 treatments a week, with at least a day or two in between. And you're doing that for 3 weeks. For pain infusions, a lot different. For pain infusions, CRPS, chronic regional pain syndrome, you're looking at doing daily treatments for 5 days, 90 minutes to up to 4 hours. And so that's important to recognize that there's a differentiation with the pain treatments. Really, the science concentrates on let's really saturate those receptor sites. That's where we see kind of the best treatment outcomes. With the mental health infusion protocol, the dosing's lower, 45-minute infusions at our clinic. And again, 2 per week for 3 weeks in combination with some sort of integration therapy, 1 to 2 days after one of those treatments. And that's where we really see the best treatment response. And that integration therapy looks a lot different for different people. If you're already working with an integration therapist or a therapist in general that you have a great rapport with, that's great. Keep working with that therapist. We do have in-house therapists at Revitalize Ketamine Clinic, and they're, trauma informed and ketamine treatment informed, and they're great. And so we do, individualized vetting. We make sure that they know what they're doing, and we really want to help them grow and feel supported in their journey. It can be hard work being a therapist for people going through such heavy stuff. And so I was talking to our therapist the other day, and it's really interesting, thinking about all the different ins and outs of that. I think one of the big things that lends itself to mental health care provider burnout is the fact that there's kind of no follow-up. So someone gets better and we don't see him anymore. That's great. When we don't see them anymore, we don't know. And so they may have gotten better. Who knows what has happened? And when you spend this much time with someone and you're rooting for them and you're hear these success stories and then they just fall off, it's kind of sad. Like I wish we had more recourse in like how do we stay up to date with one another in a safe kind of environment that doesn't break any boundaries, right? Because there's so many legalities when it comes to relationships. And so that's part of the passion behind Rocked Wellness Bar too. It's like, okay, let's bring a place together that makes it safe to continue that work in a safe environment with support and all those things. And so we also have the group integration that takes place every evening from 6 to 7 p.m. on Thursdays. So Thursday, 6 to 7 p.m. currently, that time and date may change. And it's an integration group that takes place every week and is open to everyone who's at any ketamine treatments with us. And that's really where we see, a great opportunity to have that shared experience model. Because that's the problem with these treatments is people go through these treatments, notice significant shifts and improvements, and they've got no one to talk to about it. And so being able to have that kind of discourse back and forth can be incredibly valuable. And so very happy to be able to offer that. That's at no extra cost when people are going through an induction series with us. Um, and we talked a little bit about certain medications can reduce the effectiveness of the treatment. So it's really important to that individualized assessment. And we do those free consultations. So bring yourself and a loved one and whomever else. We ask for a little placeholder. As long as you show up, we'll refund that right away if you want, or we'll apply it to your treatment, or we'll refund it if, we deem that you are not a good candidate. So it's important to just really meet you where you're at, see where you're at, see if this is a good time and a good place to start this work and if it's safe. So, how to prepare for an infusion, what to expect. So, no eating for 6 hours before an infusion. You may drink water up to 2 hours before an infusion. If you don't have nausea for a few of those infusions, we might be able to move some of those time frames up and we'll, make special adjustments for people with diabetes who are insulin dependent. Roughly 2.5 hours is what you should be budgeting for your first infusion appointment. Close to 3 hours for me. I'm just a talker. And then after that, it's about 90 minutes door to door after kind of subsequent infusions. You do need a driver for every infusion. That's really important. And it's ideal that you have someone who cares about you, kind of tuck you in, make sure you feel good. That being said, the reality is some people don't have a great support network and it's more of a detriment to, we're not going to tell people they can't have care if they don't, like, that's kind of, worse on worse, right? And so we can do ride share, we can do walking. We're just pretty hard up about you checking in when you get back to your environment safely. So I think that's super important to reiterate. We know the more we reduce the external stimulus, the deeper we're able to go and the more healing work we're able to do for ourselves. Again, this is about empowerment. This is about remembrance. I had a client say it once, it really resonated well with me. We're born remembering, we forget along the way, and our job is to remember again. And I just love that. So other things that you can do is digital detoxification, intention setting, which we help with, real life detoxification in regards to like toxic people and environments in your life. Ideally, it's just the client in the room. For the first time, the clinician will be in the room with them to make sure they're safe. Great thing about the infusion, very gentle, easy on, easy off. Within 2 to 5 minutes of starting a ketamine infusion, we're seeing those new dendrites and we're kind of steady state as far as the intensity that you're going to be experiencing. So you've got an infusion or a clinician in the room with you for your first one for at least another 15 minutes after you're kind of set off into your journey. And we're not going to engage you unless we need to. And so we want this treatment to be about you, for you, and by you. So we don't view ourselves turning that key so you can do the healing work. Really, we're very passionate about that. That's part of that intrinsic response methodology that I coined. And again, the whole premise of that is you'll always be your own best healer, and you're able to do that work easier when you get out of your own way. And so people like to know about the addiction potential of ketamine. This is courtesy of the American Society of Ketamine Providers. And you can see all the ego dissolution agents are on the bottom of that slide. I think that refined sugars somewhere way up there on the top, above, like probably busting out of there. And we're all doing the best we can with what we have. I like to say everything in moderation, including moderation. And so this is our intention setting guide and our flight instructions that we go over with our first visit that we have with the client. And so I won't go over all of them in depth right now. I might do that in a different video. It's very important to provide a safe space. And that's really what we pride ourselves on at Revitalize Ketamine Clinic is that set. So help that mindset going in that setting so we have a nice, comfortable, therapeutic and clinical environment in that you're safe. We're watching your vital signs. You have expert clinicians with ICU experience and hospital experience, and they've seen the worst of the worst. And so we're prepared for an emergency if it occurs. We'll do a physical examination so we make sure that your ticker is good, any sort of concerns that we have, we'll address with you, and any concerns that you have or your loved ones have. And we're doing a complete history and physical, so you know that you're safe. And then also sustainability. So setting, and sustainability. Again, that sustainability is like, let's fly, little bird, right? We don't want to have that circling the bowl kind of feel. We want to have that wellness set for your treatments and the goal that we're trying to get to. So, and it's very important to recognize intention is so important when you go into these types of treatments. And so we help you set that intention. We go through our whole flight instructions book that really helps to kind of understand the best way to go about it. It's evidence supported, it's science backed, and it's incredibly valuable. And it's been something that I've gleaned through many, many years of training. And yeah, it's a boiled down, real easy to understand kind of version of where we're coming from and how to get the most out of these treatments. So in closing, I really want to thank you so much for showing up today, showing up for yourself, showing up for your family members, just being present and listening to all that. I know there was a lot of mouthfuls. And if you're ready for it, now's the time we can get you in a consultation, see if this treatment is a good fit for you. It may or may not be. It's worth checking out if you've gotten this far. No risk, no obligation, and it's 30-minute appointment set up for you and your loved ones to come in, ask questions, and we can get to learn more about you. So thank you so much. I really appreciate you taking the time. Make it a great day. Remember remember what is good for you is good for the universe. All right. Thanks so much. Thank you so much for watching this video. I really appreciate it. Remember, what's good for you is good for the universe. If you did like this content and you'd like to see more of it, press subscribe, like, and just continue being awesome.